Nevertheless, there are now 2 confirmed deaths from the same ALF in Broward County, Altria Wildwood. They got 96 on the ALF side, 123 on the independent side. There's 7 positive cases total. 2 of the positives are deceased. 5 positives are from the ALF side and 2 positives are from the independent side. 6 more tests are pending. What the investigation has found out is that construction workers, staff, and cooks who were ill were not screened, were allowed to go, work their jobs, and mix with the residents unimpeded. That is exactly what you are not supposed to do. And so law enforcement will be there to help monitor the situation. We've requested the CDC to embed an infection control specialist on site. I have now, ACA has a embedded staff at the facility around the clock. But if you are an operator of one of these facilities, you need to take responsibility to protect your residents. This is a virus that is in certain communities spreading in Florida, and Broward is one of them, and you need to take action to protect your people. On a better note, I'm happy to report that yesterday we announced the launching of a drive-through test site in Broward County in conjunction with Memorial Healthcare and the Florida National Guard. And I was very measured about what to expect, because most of these sites that try to launch don't end up working out, and there's some major problems. So I told everyone, be patient, we're going to try to get it right, but I'm happy to report as of 4 o'clock, the initial goal I think was to do about 250 samples collected. They've already collected 407 samples in this one test site on their first day. This is in C.B. Smith Park, 900 North Flamingo Road, Pembroke Pines, Florida. And really the only thing you can do is go into the main gate. Hours of operation 9 a.m. to 5, Monday through Sunday. Started today, Friday, March 20th. The test results, as many of you know, there's backlogs with the private labs. Memorial Health's lab is almost online, but we'd love to turn those test results as soon as possible. But this is something where they go in, they get screened. If they pass the initial screening, they go to step 2. They fill out the registration and lab form. There's a collection. Then they leave in their car, and Broward Memorial will run the lab and inform the individual of the results. And so we would like to scale this up and hopefully replicate it around the state, because I really think that the number one thing that we need is just a lot more people to have been tested. If we had that, then I think we would be able to make some more informed choices. The federal government, thank you, Mr. President, has sent 3 packs, basically ready-made test sites. The one in Jacksonville is here, ready to go. There's about 2,500 swabs, and that is not going to be run by the federal government. I think it's going to be run by local folks in Jacksonville, and that is supposed to open tomorrow. And then Jared and I have helped with Baptist in Jacksonville. We've provided swabs so that they're doing some drive-through testing as well. So I think you're starting to see real movement on this, which is exciting. And then we're working on a launch at the Villages, big drive-through testing site. Only at the Villages, they're not going to be driving their automobiles, they're going to be driving their golf carts through. But we think that having some high-volume testing there, especially given the demographics, would be very, very good. So expanding testing continues to be one of the highest priorities of our response, and we're going to continue to do it. I put out a number of different executive orders today. One of the ones involved restaurant service in Florida. We had restricted that initially statewide, but did allow limited sit-in as long as they were spaced out enough so that someone couldn't infect someone else. And the thought was that, maybe they get a little more business and can stay afloat, and then sometimes families just need a place to go. The vast majority of restaurants did it. They abided by the restrictions. Some didn't, and it's just the type of thing that, we don't have time to police that, so we're going to takeout and delivery only. which is, somewhat unfortunate because it's going to be hard for some of these restaurants to survive in this environment. But one way I think we can help them is I have waived applicable regulations, and we will allow the restaurants to deliver with meals alcohol deliveries as well. And then because we stopped the bars on St. Patrick's Day, a lot of people had bought a lot of good stuff for that night. We're actually waiving regulations to allow them to sell it back. Because the retail, there's actually big demand for this. And so, some of these small businesses were able to do that. Heck, they may even get a premium on it because it's such in demand. So we're trying to help as best we can, but we've got to do what is safe for everybody. We also issued an executive order stopping elective and unnecessary surgeries. Part of this is you don't want those elected surgeries to take too much space in the hospital. You want, if there's a surge, to have more beds available. But actually, the more we looked at it, much more than even that was just the personal protective equipment. This is in such short supply that we need to make sure all our healthcare providers are saving their PPE and using them for potential COVID-19 patients. And so that executive order goes into effect immediately. Also signed an executive order to waive in-person meeting requirements to ensure public officials can safely continue their duties without impediment. I'm also working on a plan. As many of you know, we did the virtual semester for the universities, and the hope is that the students would actually go back to their homes and do it from there. Unfortunately, a lot of them were at the universities going to bars, so then we closed the bars and then they started going to fraternity houses and doing that. So we would want them to go back. They're going to take classes virtually. Some of the people who do that will have refunds or credits due if they haven't used their food service payments or their room. So we're going to work on refunding that. Given that they're doing remote learning, they really don't need to be paying room and board. So hopefully we'll be able to get that done through the Board of Governors. I'm also happy to report that the first small business bridge loans have been approved by the Department of Economic Opportunity. We had Full Press Apparel and Jersey Mike's Subs, small business owners, for both of those in Tallahassee. And so they're relieving loans in very quick 3-day review process after the loan program was activated on Monday. And for government work, it doesn't get any quicker than that. So I want to thank Ken Lawson for what he's doing. We're also working hard on reemployment assistance. We know it's going to be tough for a lot of people. Some people have asked about our numbers. The Department of Labor waits until the week's over to put it out. So Ken will do that. But I can tell you, obviously, if you go back 2 weeks, you saw a spike, increase last week, and then an even bigger spike this week, and you can understand why that would be the case. But I've directed Ken to no longer require a claimant to register with the state job search portal to actively seek employment. Obviously, we're in a situation where it's going to be tough before this dust settles. And then we're also going to waive penalties to employers for any type of registration with the system. And right now, there's kind of a perverse incentive an employer may have to keep an employee on the payroll, but would dramatically reduce or deferred hours, therefore preventing them from seeking unemployment assistance. And so, we want to just remove any type of unintentional gamesmanship. And then finally, some of the work requirements, which I think generally are a great idea and I'm supportive of. In this environment, we'd rather just get the relief to people. So we're going to be waiving that as well. The Department of Health has over 700 school nurses ready to help with the COVID-19 response. They're DOH employees. They can be deployed in their communities since school is out, and we really appreciate all that they're doing. So we have had close to now, as we sit here today, a little under 9,000 tests that have been conducted between the DOH labs and the private laboratories. So that is a pretty steep increase, and we obviously want to continue to scale that up. The latest numbers, so we have a total of 520 cases, 474 Florida residents. There'll be an update later tonight that will probably obviously have more. Broward and Miami-Dade continues to be the hot spot. You have 124 total in Broward, 113 total in Miami-Dade. You do have some in other parts of the state. But I think the way we look at it is, if we're able to get all these testing supplies where they needed to go, and you have a county that has 5, 10 positives, we have an opportunity doing these investigations to isolate, trace the contacts, test, kind of a South Korea model. And so that's the good news. The bad news with Broward and Dade is it's spreading throughout the community. So if you do that, that would still help, but it's not going to solve the entire problem. In Broward, of the 124 total cases, 57 have documented to be travel related, and 52 have been a known contact with a COVID patient. And so you look, that's, you still have, a dozen, 20, in that range who they're totally unlinked. And so the unlinked cases are obviously what you see when you have community spread. Miami-Dade, of the 113, 44 travel related and 30 with a known contact of COVID-19. So again, you have, a majority where you can trace, but then you have, some of these other cases. And so we're tracking all of this. We have 1,028 pending test results. And then based on what's happening today, that number is going to continue to grow. So I think there's a lot of progress being made. But look, I think a lot of people just, it's a very difficult time for folks. If you look at, you have California, New York doing things that really are extraordinary and things that we haven't seen, in this country in a long time. People don't know what's around the corner. They don't really understand what this virus can mean. And the thing I want to say is, this is not going to be easy. But we will get through it. We're going to work hard together as a community, and we're going to come out of this on the other side stronger than we are now. I can tell you people around the state are working incredibly hard on the response. If you look at what our healthcare professionals are doing, this is the equivalent of the Navy SEALs going to Abbottabad and getting bin Laden. This is the big time, all hands on deck. They are working selflessly and tirelessly. So are our first responders. A lot of folks at the local level and our local governments have been doing a great job. Folks up here on this team have been doing well. And then the federal government, the president, the vice president, and their task force, they are working around the clock as well. So I just want to thank everyone for their efforts and just let Floridians know that we're in it together. We're going to get through it. It's not going to be easy in the days and weeks to come, but we will get through it, and we'll be there for you. And with that, I'll take some questions.
Governor, I have a question. We've been hearing from some of the law enforcement in the south part of the state, and they're concerned that people aren't following quarantine measures because they're voluntary quarantines, and they're asking why you guys haven't instituted mandatory quarantines for some of these COVID patients.
Well, actually, that would be, so the people that are self-isolating. Yeah. Well, that'd be a question for the Surgeon General. You want to address that, mandatory quarantine?
Yeah, it's absolutely essential if somebody has COVID-19 that they have to self-isolate. And if we become aware of an individual who is out and about, is not staying home, we will issue a quarantine. Thank you.
Law enforcement is saying that they don't have the teeth right now because it's a voluntary quarantine.
So what I can say is, so we had the guy who got on the JetBlue flight from New York who tested positive, and he gets on the flight. JetBlue banned him for life, which I think was good. He lands, and then he wasn't going to self-isolate. And so I told the sheriff, Dr. Rivkees, as a Surgeon General in a public health emergency, he can issue a quarantine order. We're willing to do that. And so law enforcement has people who are supposed to self-isolate, particularly those who are infected. Let us know, and we'll give you the tools to be able to enforce an order like that. For a guy to get on a plane like that and then want to go out in the community afterwards, come on, you gotta do a better job than that.
Governor, we're getting a lot of calls from people who work in large retail establishments that want to wear protective masks or protective gloves as they deal with customers who they say are coughing and sneezing, yet their employers are telling them that they can't do that because they don't want to scare the customers. Do you want to weigh in on that?
Look, I think people should be able to protect themselves. If you look what South Korea did, they did not do a shutdown the way, we've kind of done in the United States. What they did was They protected the folks who were most vulnerable. They tested, but then they protected themselves. So you'd actually have people wearing the mask when they go to work and doing things like that. And, I just think employee safety is paramount. I think we're in a situation now, if this were a month ago or a year ago and you had a mask, people would be like, what are you doing maybe? But I think people understand the environment we're in. And, I would just say keep people safe. That was I think that's, obviously you've seen some businesses take a hit, but we still have a lot of employees out there. And I know a lot of them in a variety of industries have concerns. And so I would just say safety is important, and it's really the smart business decision, because if you have an employee that gets infected, then you got to isolate other people. It's not going to be good for your business either. And speaking of masks, we have, so by March 25th, we'll have 1,025,000 masks. March 28th, another 1,000,000. And then I think by the first week of April, we'll have a total of 5 million N95 masks that the state will have. We obviously want to push that out to our healthcare providers and personnel. But the mask issue and the PPE, the gowns, there's a major shortage of this stuff around the country. We're glad we got the mask. That was what 3M has done to spin that off. If we can get some more PPE for our healthcare workers, that will be very, very important. They're going at it every day, putting themselves at risk with this, and that's not an easy feeling. I mean, some of the other things they could be exposed to, they know about it and they can kind of treat. We don't know about this. There's no vaccine. We don't have an antiviral. We're hoping we get some stuff. So we appreciate what they're doing.
You mentioned before about being aware that people aren't going to just stay shut in for forever, and after a while they'll start to get just too tired of this. How essential is the testing part of it then to have that done in a quick and timely way?
Look, it's huge.
Is there a threat there's going to be another curve if we don't get
right?
done with
So doing this stuff, there's a limited duration that the society is going to be able to do it. I mean, that's just the reality. How long? Maybe people could disagree. One of the reasons why I've tried to say that you need to practice the social distancing, but you don't have to necessarily just shut in 24 hours a day, is because I think that's a more sustainable model. And the more people are shut in, I think the more anxious they get. At the villages, and obviously that's a demographic that is threatened by this. The tee sheets are filled on the golf course. But what they're doing is they wipe down the cart. Only one person sits in the cart. They don't shake hands with who they're playing with. They don't touch the flagstick. So they practice social distancing in every aspect of that, but are at least able to get out, have fun by abiding by all these restrictions. And so they're not going to get sick if they follow those guidelines. And I think that is a more sustainable model if people have the ability to do some things in a safe way. So that all being said, the more you test, the less restrictive some of these things are going to need to be on society. South Korea never did a lockdown because they did over 200,000 tests. They understood where the virus had gone, and they were able to contain it amongst a pretty large group of people. We had not had the data to do that. I mean, we were in a situation, the virus was here. Initially, people were only allowed to get tested if they had been to China or had been something like that. That has obviously broadened, and as we get more supplies and continue to do that, we're going to be able to broaden it even more, and that's going to be a huge, huge help in terms of doing this. And then any of these mitigation measures you're doing will be more targeted, and I think, kind of less harmful for society. But there's a lot of angst. I mean, you think about, the kids are not in school, and then parents are going to work or doing this or doing that. Then maybe a parent loses a job. There's just a lot of angst out there. And so if we can do this in a way that gives people a little bit of relief and outlet within the confines of being safe, I think we're better for it. Yes.
Kind of piggyback on Gray's question. I've been speaking to some legal experts, and they're saying that you're kind of in a position where you're balancing 14th Amendment rights with obviously the need to protect the public. How much of that actually goes into your strategy as you're you've been actually much more light-handed than other states have with sweeping mandates, like Ohio and Illinois and Indiana.
Well, part of that though is because I want to do things that will be followed and that will be effective. And if you go too hard, then I think people lose confidence and they rebel against it. So we've tried to have a collaborative approach, not because I don't think I have the power. Governors have in these situations some serious police powers. I'm not somebody that likes necessarily wielding that. I don't want to tell anyone what to do. That's my nature. But in this situation, you got to do it. So we've laid down some mandates. We've tried to do it as collaboratively as possible, because at the end of the day, I can issue a mandate, but if the local communities folks don't want to enforce it, then it's toothless. If the local electeds are saying we can't have this, then the people aren't going to have confidence in it. So if we're all on the same page, we're all in it together, we have a chance to make progress. So that's just, I think, the nature of it. But it's not because of power or not power. A lot of what these governors are doing traditionally in American history in these situations, they do wield a power that the federal government does not possess under a limited constitution. The states have that residual power.
Go back to the testing. Is there a goal of a certain amount of tests to get done each day, or a certain amount by a certain deadline? I know you mentioned the 625,000, but it doesn't sound like the.
So we have the test. We have enough test kits that would lead to that. We don't have enough collection swabs to lead to that. Jared has. We have an order that was supposed to be filled for 500,000 swabs. Obviously, the federal government's sending stuff, which is great. Some of the hospitals are getting them too. But if we get those swabs in, we would push those all out, and we would try to ratchet it up as quickly as possible. It's just a matter. We've been getting it in dribs and drabs. So we thought we were going to get half of it this week. Instead, we got about 6,500 or 5,000, 10,000, which is helpful. But man, if I could get more of those swabs, we could start running through people. And I've said this before, but we could also then launch diagnostic sentinel programs where we just want, hey, if you're aged 25 to 35 and you may have had a sniffle, just come through, and we'll try to see how this is in that segment of society and try to get some information and some data on that, and then we could be able to use that. I mean, we really don't know. I mean, for example, I have 2 young kids. I think it's clear that a kid can get it, like a small child. It's not clear whether the kid can transmit it or not, or how contagious they are or anything like that. But that's kind of an important thing to know, especially if the kids, whenever they go back to school. So yeah, the testing capacity, I think, would allow us to really, defeat this in a way that we, without it, it's just going to be much more difficult.
I have a question for Secretary Mayhew.
Sure.
You mentioned earlier this week that you wouldn't discuss specific facilities, but if there were an assisted living facility where 5 residents had tested positive, what would be the protocol for testing the rest of the staff and the rest of the residents?
I'm really going to defer actually to the Surgeon General, because this really falls under the Department of Health.
Yeah, thank you. When we become aware of this, we will send in a strike team. And this strike team will consist of a nurse, an epidemiologist, an infection control specialist, and somebody from ACA. And we will go door to door. We actually did this earlier this week. And we checked every resident for their temperature. We made sure that these individuals were well, made sure that they were isolated, made sure that the facility had proper decontamination and cleaning protocols in place. And then if we found a resident who was actually ill, we'd make sure that person would have medical attention. I can't emphasize enough that we have to keep COVID out of these facilities. We have to make sure that workers going in there are screened. We need to make sure that contractors going there are screened. And we actually have a command center where if a facility has a concern, they can call it up. It's manned 24 hours a day, and we will send in teams. Thank you.
Also, just I haven't really addressed it yet, but just you see some of the reporting that's come out about the origination of this virus and the actions of the Chinese government to try to cover it up, obfuscate, and not do the types of things that could have been done to save the world from having to face it. And I can tell you that given their actions and given what has happened here and will continue to happen, hopefully not too much longer, that their view, how Americans view them, will never be the same. They've never been terribly popular as a country here, but I think that we have got to hold China accountable. We've got to look at how we're making things. We can't have a hostile country be dependent on a hostile country for key things that we may need in an emergency. And I just think that you're going to see a sea change in how China is discussed in American politics, and rightfully so.
Governor, do you think that some of the comments that are being made by some members of Congress, especially in the Florida delegation, are kind of hindering efforts in terms of like stirring up the masses and claims of why didn't you shut down all the beaches or shut down this or that? I mean, is that?
I wouldn't know because I haven't followed any of the stuff they do. People are going to chirp. That's just the way the politicians are. We've been working day and night on this. I think that this is more challenging than a hurricane in terms of all the things going on. And so we're just going to keep going. Everything we've done has been in consultation with all the local governments on all these issues. And we're trying to strike the right balance and getting the right policies for sometimes different policies for different parts of the state, just given the different challenges that you're facing. And we've been willing to work with people, whether they're Republicans or Democrats. I mean, the first test site, we launched with the National Guard is in the most Democratic county in Florida, in Broward, because we're there to serve. We're not there to play politics. And so I wouldn't expect very much more from members of Congress, quite frankly. But, I'm going to let them chirp, and I'm going to work.
One last question.
There's been a couple of requests from different lawmakers to extend deadlines on different things. Basically, a moratorium on evictions, certain payments. I think quarterly corporate income tax payments are due at the end of the month. Have you heard any of that? Have those requests gotten to you, and any more of that coming?
I don't know specifically what requests we received, but I would say that we're interested in looking at any action we can take that will get us through this hopefully short-term but difficult period. And we understand how government policy at the federal, state, and local level have caused some of the business interruption here, and whether that's an individual worker or business, I think we have to look at everything we can to make it as smooth as possible to get on the other side of this. I think we can come back really strong. I think we've got a lot of great things going on in this state. But this is not something that's just going to happen overnight. It's going to require a lot of hard work. And so if folks are negatively impacted, I think the least we can do is look to see the lay of the land, how we can help. Now, we have done a bunch of stuff already, but if there's more to do, I'm interested in helping. Thanks.
Thank you, everyone.
Good night, satellite.